Most men will spend hundreds of dollars on supplements, drive past 3 pharmacies, and Google things they'd never say out loud before they ever consider that the answer might literally be on their own body, about the size of a 50-cent coin, sitting there completely ignored. Today, we're changing that. I'm going to walk you through 7 things most men never knew about a single pressure point that traditional medicine has quietly recognized for centuries and that modern science is finally catching up to explain. No pills, no appointments, no awkwardness. Well, maybe just a little at first, but stick with me and you might be surprised just how easy it can be to revive your fun time in the bedroom. Fact number 1, there is a pressure point between your legs that most men have never deliberately touched. Let us start with the basics, because this is where most jaws drop a little. There is an area on the male body called the perineum. It sits between the base of the scrotum and the tailbone. In traditional Chinese medicine, it has been called the $1,000,000 point. And no, that is not marketing language. That name has existed for centuries. Why the dramatic title? Because it sits directly above a junction of nerves, blood vessels, and the base of the pelvic floor, all of which play a direct role in erections, sensation, and bladder control. Modern anatomy confirms it. This area sits adjacent to the pudendal nerve, one of the most important nerves in male sexual function, and directly above the prostate gland. So when men experience tightness, poor circulation, or declining function, this spot is often ground zero, and it is also where targeted pressure can actually help. Most men have just never been told it exists. Okay, now that we know the spot exists, here is what nobody talks about: why it stops working properly in the first place. And the answer might surprise you. Fact number 2, your pelvic floor is probably simultaneously tight and weak. Here's the paradox that trips up a lot of men, and even some healthcare providers. Most people assume that a weak pelvic floor means it is floppy and underactive. But in reality, chronically tight pelvic floor muscles are actually a form of weakness because they have lost their ability to flex, respond, and recover. Think of it like this. Imagine a garden hose that someone has been standing on for 10 years. It is not broken, but it has been compressed for so long that even when the foot comes off, water barely trickles through. That is what years of desk work, stress, and inactivity do to the muscles and blood vessels in your pelvic region. The perineum sits right at the center of this tension pattern. Gently massaging this area is not just about circulation, it is about signaling your nervous system to release a holding pattern it may have been stuck in for years. And here is where it gets really interesting, because once that tension releases, the changes do not just show up where you expect them. Number 3 might be the most surprising fact in this whole video. Fact number 3. The benefits go way beyond the bedroom. This is the one that catches men completely off guard. When men start regularly releasing tension in the perineal area, the first improvements they often report have nothing to do with erections. They notice their lower back pain eases, their hips feel less locked up, their bladder urgency decreases, they sleep better, they feel less daily tension in the lower half of their body. That is because the pelvic floor does not operate in isolation. It connects upward to your core, downward to your legs, and outward through a web of nerves and fascia that influence your entire lower body. When one part of that system releases, the whole network breathes a little easier. Now, does this mean perineal massage is a cure-all? No. But it does mean that for many men, the payoff extends far beyond what they signed up for, and that is a genuinely good surprise to have. So we have the location, the science, and the surprising side benefits. Now let's talk about how to actually do this because technique genuinely matters here, and most people get it wrong in a way that stops results before they start. Fact number 4. The technique matters more than the duration. Here is some genuinely good news. You do not need to spend a long time doing this. Research on pelvic floor release and perineal stimulation consistently shows that short, consistent sessions outperform long, infrequent ones. 1 to 2 minutes a day produces better outcomes than 10 minutes on a Sunday. Your body learns through repetition, not marathon sessions. Here is a simple, effective approach. Find the spot. About 2 to 3 centimeters back from the base of the scrotum toward the tailbone. You're looking for a small area that feels slightly softer than the surrounding tissue and often mildly tender on first contact. Apply gentle, firm pressure. Use 2 fingers. The pressure should feel like pressing a ripe piece of fruit. You want to feel resistance, not force through it. Use small, circular movements. 30 seconds clockwise, 30 seconds counterclockwise. This creates a gentle pumping action that encourages blood movement through the area. Or try press and hold. 5 seconds of firm pressure, then full release. Repeat several times. This rhythm mimics the body's natural vascular pulse. That is it. No equipment, no class to attend, no prescription required. Now, some men do ask, is there anything you can add to this routine to make it more effective? The answer is yes, and it is probably already in your kitchen. Fact 5. Certain natural oils can amplify the effect. This step is optional, but it's worth knowing because the right oil can shift this from a simple massage into something that actively nourishes tissue at the same time. 3 oils have solid traditional and emerging scientific support in this context. Castor oil is thick, deeply penetrating, and has been used for centuries to reduce inflammation and improve local circulation. A warm application before massage lets it soak into the tissue rather than sit on the surface. Coconut oil is gentler, it has natural antibacterial properties, and it is much easier to find. It's a good everyday option for men who want something simple and skin-friendly. Black seed oil, also called Nigella sativa, has an extraordinary traditional track record across Middle Eastern and South Asian medicine, and emerging research suggests modest but real effects on testosterone levels and circulation. The key with any of them is to warm the oil in your hands before applying. Cold oil on sensitive skin is unpleasant, and warmth itself improves blood flow before you've even started. All right? We've covered the what, the where, the how, and the extras. Now let's talk about what to realistically expect, because managing your timeline is actually one of the most important parts of making this work. Fact number 6, there's a real timeline, and patience in week 2 is everything. This is where a lot of men give up, and it's entirely understandable, because the body doesn't always give you early wins. Here's an honest breakdown of what the evidence and clinical experience suggest. Weeks 1 to 3. Most men notice pelvic relaxation, less tension when sitting, and improvements in bladder comfort before any change in erectile function. This is actually a good sign. Your nervous system is recalibrating. Weeks 4 to 6. This is where the shift tends to happen. Studies on pelvic floor therapy and perineal massage show roughly 40% of men report meaningful improvement in erectile function within this window. Morning erections return. Things feel more responsive. Confidence quietly starts to rebuild. Weeks 8 to 12. Results tend to stabilize into a new baseline. And here's the real gift. Benefits from consistent pelvic floor work can persist for 6 to 12 months, even after you scale back. The 2-week mark is the critical test. Almost every man who sticks past week 2 reports being glad they did. It's a small patience investment for a potentially significant return. And speaking of returns, the last fact on our list today is probably the most important one of all, because it reframes this entire conversation in a way that changes how you think about aging itself. Fact 7. This isn't about fighting age, it's about communicating with your body again. Here's the thing that gets lost in all the noise around men's health, supplements, and performance. Declining function in your 50s, 60s, and 70s is rarely about your body failing. It is usually about your body being ignored. We sit more, we move less, we carry stress in places we cannot see. Over time, our bodies quietly adapt to that neglect by tightening up, reducing circulation, and conserving resources. The perineal pressure technique is not magic. It is communication. It is you putting your attention on a part of your body that's been waiting, sometimes for years, for a signal that it still matters, that circulation is welcome, that tension is allowed to release. That is not mystical. That is physiology. What is remarkable is how quickly the body responds when you actually show up for it. Not with aggression, not with expensive intervention, but with consistency and gentleness. Men in their 60s have experienced meaningful restoration of function using approaches like this, not because their bodies were broken, but because nobody had ever taught them that these tools existed. Now you know. You don't need to overhaul your life, spend a fortune, or feel embarrassed about any of this. You just need consistency, a little patience beyond week 2, and the willingness to treat your body like something worth caring for, because it is.